Welcome to Coding Corner, your one-stop shop for navigating the exciting and sometimes mind-bending world of OASIS coding and documentation review. Meet your dynamic duo, Stephanie and Tina, from HealthRev Partners, setting out to demystify the latest tips and equip you with the knowledge and skills to conquer any OASIS challenge. Whether you're a seasoned coding veteran or just starting on your coding journey, Coding Corner has something for everyone. Get ready to unravel the mysteries of complex coding scenarios, stay ahead of the curve with the latest updates and best practices, level up your skills with practical tips and tricks, gain confidence in your coding abilities, and laugh along the way, because coding doesn't have to be all serious business, right? So grab your cup of coffee, your decision health guidance, and get ready, because we're going to do this.
Stephanie, you mentioned OASIS Walk. So can you tell us a little bit more about that for the clinicians that may not know what that includes?
Well, the OASIS Walk is really important. It's the most important part of the assessment. You can't take a patient's word for it. You really need to be able to get that patient up and out of their chair. If they're bed fast or chair fast, obviously you're not going to be able to do that. But if this patient has the ability to walk, you want them to get up, because when they're getting up, you might say, "Hey, can you show me your bathroom? I'd like to see what equipment you have in there." And that way they're like, "Okay, I'll demonstrate for you." While you're watching them walk to the bathroom, you're noticing, are they grimacing with pain? Are they holding on to their left hip? Are they short of breath? Is their gait steady? Do they have poor balance? There's so many things that you can grab in that 1 minute that you're watching them walk to the bathroom. I feel that you're doing an inadequate OASIS assessment if you are not utilizing the OASIS Walk, meaning getting your patient up and around the house. Now, it could be different depending on how sick they are, but another good point to make is if they are extremely sick, and you say, "Hey, Mrs. Smith, do you think you could sit up in bed for me and put your feet on the floor?" That right there, that might take her 2 minutes, right? But you need to see if she has the ability to do it or not. Can she do it safely? Can she do it effectively? And can she do it efficiently? And if not, then you've got to score her as least independent as possible. And as the home health agency works with the patient in the home, you're going to be able to increase those scores, which is demonstrated at discharge.
Yeah,
in
I
the
think
OASIS.
that's a really good point, because I think some of these clinicians think, okay, I got to answer M1820 and then M1840 and maybe even 1400, but just in that OASIS Walk, that includes so many of the other M items. So I think you really need to be thinking about that and thinking about the whole picture of the patient as they do that OASIS Walk. That's going to help you score a lot of other M items as well.
And I think a lot of clinicians like to, maybe they think the OASIS is an interview type of assessment.
Right.
And really OASIS is not interviewing. It is more observation, and it's talking to the family members, but just something to keep in mind that an OASIS assessment really is hands-on observation.
Yeah, and
More
it's
than
going to make
anything.
it more interactive, because if you take each M item and you say, "Oh, well, walk me to the bathroom," or, "Where's your walker?" or, "Your oxygen." But if you're looking at the patient as a whole and you have them complete less task, right, just by having your observation skills more keen, then you're going to ask less of the patient and they're going to be more cooperative.
And if you ask a patient, "Hey, do you get short of breath?" more than likely they're going to say, "No, I don't get
Right.
short of breath." Or, every now and then. You really need to see that. Go in the home, have them take off their shoes and put them back on and observe them. Now you're observing them, for M1820 and maybe even M1845, but you're also observing for M1400 at the same time. So
Yeah.
that's why the OASIS Walk is really one of the most important aspects of teaching for home health agencies that have preceptors in the field and that kind of thing. It's really important to make sure that the patient is getting up and demonstrating what they can do comfortably and safely, most of all.
Yeah. And you're not asking them question after question, right? Because that's where a lot of patients
Nobody
get
likes that.
frustrated.
Right.
No. So that's why don't phrase it in a question form, but do it more in that observation form and more interactive where it makes them feel more comfortable with you.
Thank you for joining us for this episode of Coding Corner, brought to you by HealthRev Partners. Grow your agency and expand your mission with a high-power revenue cycle management partner, powered by Velocity, the most advanced coding and billing software in the market for transparency, analytics, and clinical intelligence.